Welcome to the Humber and North Yorkshire local maternity and neonatal system. We've made this film to support you and your family in making choices about your maternity journey.
Once you've found out that you're pregnant, one of the first things that you'll want to do is contact your local team of community midwives. You can find out their contact details through the Humber and North Yorkshire local maternity and neonatal system website or through your local GP. You'll have your very first appointment with one of the community midwives. That appointment is called a booking appointment.
So we take a full medical history, take some bloods from them, a urine sample, we book them for their scan and clinic appointment and book any follow-up appointments that they might need.
Most mothers-to-be choose to give birth in their local hospital, but you can elect to give birth at home or in any of our hospitals. The wide range of facilities in our maternity wards provide your ideal birthing experience. You can find out what's available at your local hospital in the short films on our website. They also tell you about parking, arrangements for appointments, giving birth and other useful information. Before giving birth, you will attend a series of appointments with your community midwife or consultant.
They can be cared for by midwives, which is midwifery-led care, or if they have any complications or any long-standing health issues, they would be cared for by an obstetrician with input from the midwife. So we call that consultant-led care. If at any point in the journey, if a woman is in midwifery-led care and there are any problems, they would be referred to a consultant.
But you will also receive scans at the hospital.
So these are detailed checks of babies, making sure they're growing properly, checking there's no abnormality. So it's a very detailed medical examination. So most people are scanned twice. It depends on what risk pathway you're on. So the first scan we often perform is the dating scan. We check through the baby, make sure they look healthy for the stage that they're at. And then we also measure baby to provide a due date. And then we have the 20-week anatomy scan. So the main purpose of that scan is to check that baby's healthy in a lot more detail than we can at the 12-week scan. So we'll look through them head to toe, make sure there's no problems in all of the organs. So everything that we can see we will check. And if we are able to have a look and see whether it's a little boy or a little girl, then we can do that as well.
You and your partner will also have the opportunity to attend antenatal classes for advice and practical skills to prepare for birth and parenting. If you have any questions during your pregnancy, there's lots of information on our local websites and on the main NHS website. You can also contact your community midwife team or chat to a qualified clinician on our convenient Facebook page, Ask a Midwife.
Language is a very powerful tool. Lots and lots of different questions come through and we're able to signpost them to the right people, and we can keep a lot of women out of the hospital.
At your 36 week antenatal appointment, you will go through what's called a birth plan with your midwife, and it's an opportunity for the midwife to discuss with you things like the signs and symptoms of labour and what to look out for.
When you think you're ready to give birth, contact the hospital midwife team to arrange to come into the birthing ward. If you're giving birth at home, contact your community midwife team. You can check the procedures to follow at your chosen hospital in our short films.
There are lots of different methods of pain relief available to you. Paracetamol is the obvious one, but there are various other things. TENS machines are really brilliant. If you're at home, you can use them and on your transfer into hospital. Entinox is the posh word for gas and air. That's readily available, and it's also available if you choose a home birth. Water is an excellent method of pain relief, and birth pools are available to use at the various different units.
Epidurals are administered in consultant-led areas. An operating theatre is available should surgical intervention be needed.
Cesarean sections can be either decided before they go into labour, or sometimes it's while they go through labour. They sometimes become high risk or the situation changes. Babies tend to dictate what happens in birth.
So induction of labour could be suggested for many different reasons. For quite a long time we've used a hormonal method. So a woman would be admitted to a hospital, be given a hormone tablet, and then over the course of that period that would help to induce the labour. More and more often now we're using something called a balloon catheter induction, which is more of a mechanical induction. It's just a small tube that's passed into the cervix, which just mechanically puts some pressure on the cervix.
After giving birth, your baby will be given a full examination by a doctor or a midwife qualified in baby checks. You may go home directly from the labour ward or be transferred to the postnatal ward before being discharged. If your baby needs special care after birth, for instance, if they were born prematurely, they would be transferred to a special care baby unit for neonatal care. Most neonatal wards have facilities for parents to stay with their babies.
Following the birth of your baby, the midwives will continue to provide care for you during the postnatal period. And this is for a minimum of 10 days. They will hand over your care to the local health visiting team. And then they usually will arrange to visit you between day 10 and day 14, and the health visitor will continue to provide care and support throughout the early years.
We continue to improve our maternity services with help from members of the Maternity Voices Partnership.
It's really fundamental that we get those experiences and that feedback. When service users are involved in designing the services, you just get much better outcomes, you get much better input and engagement, and everybody all round just has an experience that they need in that really important moment in life when you're having a baby.
It's a long journey, pregnancy, but the care that you're invited to be able to take up is excellent, really, and you do feel very looked after, and your baby feels very looked after.
They've been really informative, really helpful along the way, every step.
Absolutely everybody was friendly, which to me is something that just makes a huge difference. It made me feel very comfortable on the ward, which I think is really important, especially when you're doing something as crazy as starting your parenthood journey.
We've got a team of people that are here to provide care for women at whatever point in their journey.
Our aim is to give our patients and their families the best experience.
You can find more information and watch more short films about your maternity journey and parenting on our website or Ask a Midwife Facebook page.